25% will have hardly any symptoms and will sail through. 50% of us will have a mixed bag of symptoms that really do impact on our quality of life. Another 25% will be severely affected. And sadly we do hear of women ending their lives because they can't cope with the symptoms of the menopause. With all the publicity and all the push for HRT that it is the only solution and it's going to be the full answer and the magic wand, and it's not. My name's Tessa, I'm a nurse. I've been nursing now for over 30 years. Really got interested in a lot of women's health through all those stages of life. I guess from being a midwife, I was also a health visitor for a while and looking after women through those really important life stages, and then coming into the menopause. My interest peaked as I started to go through my own menopause journey and realising how much of those women I was seeing on a day-to-day basis are also going through the menopause and how much support women need.
So what inspired you to become a specialist in kind of menopause and kind of holistic health?
Yeah, well, the backstory to really looking at lifestyle wellness and how it can really impact on prevention of poor health and improving outcomes was probably 10 years ago when a patient came to me having reversed his type 2 diabetes. Having read, bless him, Michael Mosley's book, the 8-week blood sugar diet. I, as a nurse, I've been a nurse, as you know, for a long time, and I'd never ever heard of anybody reversing. You were told it's not reversible, it's progressive, it's only going to get worse with time. And this guy, through changing his diet, had reversed his diabetes, and I thought, wow. So I started reading, researching, and just really fell down that rabbit hole of, wow, there is so much we can do to prevent poor health, to improve how we feel, our overall well-being, physically, mentally. So much we can do by looking after ourselves holistically. And that's really led a lot of my professional nursing care and my dealings with patients over the years. And that women's health has been a big part of my career in general practice. But for me, as I then started my menopause journey, I started to really have that heightened awareness of, gosh, a lot of these symptoms are also impacted by all those things that impacted how that reversed that gentleman's type 2 diabetes, diet, lifestyle, exercise, how that can have an impact on menopause symptoms as well, and what we can do to really improve our health.
So could you briefly explain what the menopause is and how it affects women?
Of course, I'm not sure there's a brief answer to that question, but the menopause is that point when we lose our reproductive capability, that point at which our ovaries are no longer releasing eggs. And gradually, over the years, we lose the amount of eggs that the ovaries have to that point where we can no longer actually release an egg. At that point, we become menopausal. And it's almost a line in the sand, if you like, that point at which we have that very final period, that very final egg that gets released. And then we become postmenopausal. And we only know we've reached that menopause point, really, when we've gone a full 12 months without having a period.
Okay.
In the lead up to that point where our ovarian function is starting its decline, if you like, we start to see our hormones, our sex hormones, so our estrogen, our progesterone, our testosterone, all start to fluctuate. So the body it's trying to keep going, if you like, with that monthly cycle. But we see this great fluctuation in hormones. And it's those changes, those fluctuations and the drop in those hormonal levels that give rise to lots of menopause symptoms, which I'm sure we're going to talk about, and how that affects women. And it's a huge time of change and transition that can be extremely difficult for a large number of women.
Yeah. Could you tell us more about what kind of symptoms that women typically see when they begin menopause?
Yeah, of course. So we typically split it into two camps. We have the physical side and we have the more psychological side. So the physical side, a lot of women will talk firstly about hot flushes. They are one of the commonest symptoms for a lot of women, but it's so more far-reaching than that with physical symptoms. It can be muscle pain, joint pain, skin, hair, nail changes. We can have gut changes as well, so our digestive tract can change. We might suffer with less tolerance to certain foods, more indigestion or bloating. We could have bowel changes. All of these things can be happening. Poor sleep disturbances that a lot of women will struggle with, whether that's triggered by hot flushes and things, or just changing our routine and our ability to have good quality sleep. And we can have bladder changes, we can have vaginal discomfort, pain, irritation. So really head to toe physical changes that we see because of the changes in our hormone levels. And then when we look at the psychological issues, huge area that women, and in some ways more debilitating than the physical side, irritability, anxiety, brain fog. A lot of women will describe where they just lose their train of thought, they can't find the words, they can't remember people's names, loss of confidence. It can really affect that feeling of that sense of self, if you like, who we are, who we feel we were. We can lose sight of that woman that we were as we have all these changes and difficulties as we go through the menopause. And it can be very variable as well, so no two women will have the same set of symptoms, and everybody's different, everybody's journey is different, and things can change. So what symptoms we might have 1 month may be different the next, and which can make it difficult to realise that this might be, or these symptoms might be related to the menopause, because you might say have some joint and muscle pains that you might put down to something else, and then they may get better, and you may have then disturbed sleep, which you could explain away by problems at work and thoughts whizzing around in your head. And sometimes it's often not until we look back reflectively that we can see, actually, I think that was the start of my menopause journey when I started having some of these symptoms.
How can the menopause affect kind of mental health and emotional well-being?
Hugely, first off, and really debilitating for a lot of women. Irritability, loss of concentration, anxiety. And if you're struggling with some of those symptoms, it can affect your ability to do your job properly, can affect your relationships, whether that's friends, family, your partner, your children, your parents, those people close to you in your life. If you're more snappy, you're irritable, you don't like, it can be the slightest thing that women can describe, a rage that comes on out of nowhere. And if you're suddenly experiencing that with your nearest and dearest, it can really take its toll on those relationships. At work, women describe, especially women perhaps in more, or any role really, that a job that they've done and they've been confident in, they can go in, they know what they're doing, to suddenly think, oh my goodness, I don't know what to do, I can't remember. And it can really then knock your confidence, exacerbate that anxiety that you're already feeling, and it can sort of really snowball. Yeah. Women can really struggle with low mood and depression. And all of these things, they can all interplay on some of the other symptoms, because if you're struggling with those, low mood, anxiety, may affect your ability to sleep well. And then if you're more tired, it's going to make things like that brain fog worse, because if you've not slept well, it's going to make that irritability worse. When we look at food and food choices, it's going to have an impact there, which then that can have a knock-on effect on those psychological symptoms. So things are never in isolation, they're all interrelated, and one symptom can exacerbate and worsen others. But yeah, it can have a huge impact. And we see women actually leaving their jobs at work because they feel unsupported. They feel unable perhaps to talk about the menopause, that they feel it's a bad thing to show that they're struggling, and choosing to leave their jobs or be off sick. And that toll that then has on the workforce and the workplace is huge, and that impact on society.
Absolutely.
If you think women, half of the population, if it starts in our for some early 40s, typically mid 40s onwards, you've got a third perhaps of women's lives that are affected by some of these symptoms and that effect on society.
Do you think the workplaces could be like a little bit more supportive for women who are going through the menopause?
Definitely, and I hear mixed stories. Some workplaces are brilliant and have menopause champions, and they have speakers come in and they offer support, and they're opening up that conversation about the menopause. But unfortunately, we see the flip side to that, where women are hugely unsupported, or being demoted or even made redundant, I've seen, through because of their performance is affected through their menopause symptoms, and just really, really struggling in the workplace, that they don't feel there's anywhere to turn. And it may be, I guess we're still in the early days of raising awareness about the menopause. We feel it might be everywhere at the moment for those of us that are in that space, but for those who it's not on their radar, they may just not be aware and don't understand. So we've got to continue opening up those conversations in the workplace.
How can women in their 30s or 40s kind of prepare for the menopause to try and make that transition a little bit smoother?
Yeah, we need to target those younger women really, because certainly, like for me, it came out of the blue.
Really?
Yeah, it wasn't on my radar at all. I did quite a lot of exercise, and I'd been to a physio for hip and joint pain. And they said to me, do you think this could be the menopause? I'm going, really? So yeah, we need to be preparing. I think understanding, awareness is key, like we've talked about in the workplace. And if we're educating everybody about the menopause to help them understand, you could even be at school, couldn't you, when you're learning about reproduction and life stages, menopause is a huge part of that, and we should be educating so that people are aware from an early age. But for women specifically, we need to think about the health consequences. And I know we've talked about symptoms, but women's health changes as we see those changes and drops in those hormones. Our health risks become more apparent. So chronic disease, metabolic health changes, which can lead to cardiovascular disease risk, things like type 2 diabetes. Women are more at risk of Alzheimer's. Not to mention the loss of muscle mass, bone density, which leads to osteoporosis further down the line. These risks are all very much a part of the picture of women's health and how that changes. We can do a lot to prevent those risks, but we need to start. It's never too late, but ideally if we can start early, so these women in their 30s, early 40s, thinking about how can I get myself into the best shape? Because we know if our metabolism isn't good because of poor lifestyle, poor dietary choices, lack of exercise, those symptoms are going to be worse. Those health risks are going to be much worse for us as we go through the menopause and beyond. We want to age well. So we need to be thinking about protecting our older lady body. We need to be thinking about that, in our 30s. The modern diets that are out there now are detrimental to our health, with the packaged food, processed foods, too much sugars. So if we can look to stay on top of our health, improve our health, we're going to massively improve things as we age.
Okay. What role do genetics play in kind of the symptoms in a woman's experience during the menopause?
Not sure scientifically, I can answer that question. There may be some evidence out there for genetics, but from experience, what I tend to see is that women may follow a similar age to their mothers or grandmothers. Certainly women who may experience an early menopause, so some women have a menopause under the age of 40. Symptom-wise, I think it's hugely variable. We may again see patterns in families, whether that's to do with lifestyle, because often we see the same lifestyle patterns in families, but not always. But I think the biggest influencer on symptoms is going to be some of those external stresses, those lifestyle stresses. And I think modern life as well is very stressful. There's a lot of pressures on women that perhaps weren't there 50 years ago, 100 years ago. Women are working harder, longer hours. We may have had children later, so we may still have much younger children at home. We may be caring for elderly relatives. The pressure to go all the time, isn't it, adds to that lack of time for ourselves.
Yeah.
which is all really, really important.